Dear friends, welcome to the Military Diplomacy. In this video we're gonna talk about the Indian COVID strain mixing together with the Brazilian, but before it I wanna show you a little bit of information.
As the pandemic continues, variants have become the latest concern, with notable examples detected in South Africa, Brazil and the UK. But variants are complicated. Each one is made up of a collection of mutations, all of which have the potential to change the SARS-CoV-2 virus in unexpected ways. Viruses multiply by copying their genomes over and over. But, like an old photocopier, these copies aren't always perfect. Each of these imperfect copies is a variant. Normally, the imperfections or mutations don't change how the virus behaves, and they can often make it less successful than the original strain. But very rarely, mutations can change the virus in some important ways. It could become more infectious, or more able to avoid the immune system. The more a virus is allowed to replicate unchecked, the more chance it has to accumulate these rare, beneficial mutations. That can occur when viruses are allowed to spread quickly through a population, or if they encounter a host that's less able to fight them, such as people with compromised immune systems from medical treatment, or those who are HIV positive. If a particular set of mutations makes a variant more successful, it might become more prominent than others, and that's when it gets noticed. Epidemiologists may even decide to label it a variant of concern, like the examples identified in Brazil, South Africa, and the UK. But scientists are still taking the threat posed by variants seriously, and there are several things that can be done to help tackle it. To how these mutated viruses could affect global vaccination efforts. Existing vaccines can be redesigned, and combinations of vaccines are also being tested, but it could be difficult to perform reliable clinical trials amid the ongoing vaccination programs. Right now, though, work needs to continue at a national level. Public health policies such as track and trace, social distancing and vaccine rollouts are powerful tools to interrupt transmission and keep tabs on new variants. After all, every time the virus is prevented from spreading, it's also prevented from mutating, nipping new variants in the bud before they even have a chance to develop.
Now that you understand more about the strains and how the virus mutates, let's go deeper into the subject about the Indian virus and why this is so important, so concerning to the Brazilian society. Just like the Brazilian virus, South African virus and United Kingdom virus, the Indian virus also are a junction, a fusion of three other different coronavirus into one. The virus suffer mutations in three different areas of India and gather together in just one. Just like the Brazilian virus, that is a combination of three different kinds of coronavirus into one, and in this second wave is being so much deadful and so much transmittable, the virus of India also are a triple virus exactly like the Brazilian. So when the Brazilian virus meets with the Indian virus and they can gather together, making one more virus, one kind of virus, more harmful, more deadly, more spreadable, imagine how bad this would be to the Brazilian society and why not to the world. So we can guess that when these two strains of virus gather together, combine themselves into one, we can expect to see the virus being way more devastating, the health system collapse in such a way that we have never seen before until now. It's worthy to highlight that no big pharma company came to the media to state that their vaccines are enough to protect people from two triple strains that merge just like the Brazilian strain and the Indian strain until now. We know the vaccines are the solutions for triple strains like the Brazilian, South African and UK strains alone, but no one knows what happened when they merge. I also would like to highlight that this Indian strain was the responsible to collapse the Indian medical system in a matter of weeks. The not official, the unofficial numbers stated by some doctors in India are that 10,000 people per day are dying in India due to this new strain because they are not dying in the hospital, they are dying in their homes. So, we only can imagine how bad this will go for the Brazilian healthcare system when this strain merge with the Brazilian strain, and how bad this will be for the world healthcare system. So the channel official position is pray for India, pray for Brazil. India and Brazil needs all of our praying, all of our love, all of our support. And please keep the social distancing, keep using alcohol in gel, keep using mask, and keep vaccinating. Please do it. This is the official position of the channel. Follow the healthcare system of your country, follow the rules, and please stay at home as much as possible and send love, send praying for Brazil and to India. And please comment below, send your love to India, to Brazil below, and pray for them. Share this video, like this video, show to your friends, and for now we just need a little bit of luck.
Pressa da vacina não se justifica, porque você pressa da vacina não se justifica, porque você